Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Audra King. She's a surgery resident. Today's Kevin MD article is Diary of a Resident, Dr. Punching Bag, MD. Audra, welcome to the podcast by Kevin MD.
Thank you. I'm glad to be here.
So you're a surgery resident. So tell us a little bit about your story and journey.
Yeah, absolutely. So I'm currently a surgical resident in my third year of training at the University of North Dakota. I'm originally from rural southeastern Oklahoma, a very small town. Ended up actually starting out at a community college because it was a little bit cheaper, transferred to a public university, and then ended up getting into medical school at OU.
Mhm.
Didn't really know what I wanted to do, going into med school. I definitely didn't think I wanted to do surgery, but fell in love with surgery on my rotation, and here I am.
All right. So
Yeah.
tell us about what about surgery appealed to you as a medical student.
Yeah, I think it was just really the culture of it. And I am personally a person who really enjoys working with my hands and procedures and
Hmm.
just being able to do that all day and, go, go, go. I guess to me, it's more fun than kind of sitting at a desk throughout the day. I don't know, I kind of enjoy the faster pace and the environment.
All right. So you wrote this Kevin
Yeah.
MD article about your surgery residency, Diary of a Resident, Dr. Punching Bag, MD. So tell us the events that led you to write this article, and then of course we'll talk about the article itself.
Yeah, absolutely. So re really it started out as a venting session. I started journaling, to kind of try to cope with stress, and that's how this article started. I'd had a rough day and just wanted to write everything out, and eventually, I got more and more of my frustrations out, and it, kind of came together as this article. And I think what makes it really important is I'm glad I'm able to share, my story with other people because I think a lot of people don't understand a lot of the difficulties that residents go through on a
Hmm.
daily basis. I think everybody's aware of, we're underpaid, we're overworked. And coming into residency, I was ready for that. I was completely prepared for that. But I think what I wasn't ready for was just the daily, subtle with a range from subtle to more overt disrespect that residents typically get from a good portion of the hospital throughout the day, most days. It's anything like it just a lot of people, they'll make you feel like your presence just really doesn't matter. And it really does, like kind of like I mentioned in the article during third year, of medical school, your clinical rotations, first 2 years probably went well, and you kind of get slapped with, you know, third year of rotations, and it's just, people treat you pretty badly,
Hmm.
and it may not even be that they necessarily realize that they're doing it, that you feel out of place, you constantly feel like you're in the way. And it's not a great learning environment a lot of the time. And I think for me, my hope was when I started intern year, is actually, I've gotten my degree, I'm a physician, maybe things will change now and people will, be a little more, respectful. And that really didn't happen. I
Hmm.
found myself dealing with the same things with scrub techs treating me like it was my first day ever in the OR, and I didn't know how to scrub in and just kind of talking down to me. And I think it's just, and the same kind of thing, floor nurses, it's kind of the same story. And and I wouldn't say, it's not an issue at my specific program.
Okay.
I've been at OU for med school. I've talked to other residents at other programs. It seems to be a pretty systematic issue. It seems to be like, like kind of a nationwide thing. So that's not for me to say that, it's my program is the issue because it's actually, everybody's been very wonderful at University of North Dakota. Residents are very supportive of each other for the most part. The attendings are supportive. I think the issue arises when, these instances happen and sometimes the attendings in the room, sometimes they're not. And
Hmm.
9 times out of 10, they just don't say anything.
Hmm.
And I think that's kind of what hurts more is just like that they have the power to do something about
Sure.
that, whereas residents, we are more powerless. Once you match into a position, you're kind of stuck. If you get let go from that residency position, like you really don't have a lot of options. And when you're $200,000 or more in debt, like you
Hmm.
really, it's terrifying to think about, losing your job. So you really, like, we're taught to just keep our head down, take it, and push through. Don't cause problems, don't make noise. Um, and it's really like when the attending is in the room witnessing this, and you know that they could do something about it, and they don't. It gets kind of hurtful, to have that happen. I just want people to know, what we go through.
Sure.
It's it's hard, and I don't know what the answer is to fix it, because it does. I think it's kind of human nature to, for a lot of people, when someone is powerless, they take that chance,
Hmm.
to be disrespectful, because what can you do about it? Nothing. And I don't know how to fix that, you know.
So, what are some of the stories that you've heard where residents would be disrespected? It sounds like a lot of microaggressions. So, just tell us a
Hmm.
story that you've heard, just so my listeners can really envision that scenario.
Yeah, absolutely. Actually, one of my friends, and she's also a female surgery resident, so I feel like this is a factor in things as well.
Hmm.
But that's a whole nother story. She, was walking around on the floor, taking care of orders, checking on patients, and one of the charge nurses tried to get her attention by, like, kind of rudely yelling at her, like, "Hey, surgery girl,"
Hmm.
which is, in my mind, completely inappropriate. Day one intern is still a professional. They have an MD degree or a DO degree, and I can't imagine disrespecting someone in their workplace like that. But for some reason, people have decided that it's okay to do that to residents.
And to be clear, this is what you think is happening nationwide when you talk to your friends and colleagues from hospitals across the country. This seems to be a universal phenomenon. Is that correct?
Yes, absolutely correct. Again, it's like, and that's what makes it so difficult is, you know, it's not something that any single program can fix. It's not something that any single person can fix. Really, what's ultimately the solution would be for somehow to even out that power imbalance that heavily disfavors residents. And I'm really not sure how to accomplish that.
So when you're on the receiving end of these microaggressions and you already have so much on your plate, you're waking up at who knows what time, starting rounds early and spending the majority of the
Mhm.
days in the operating room. Afterwards, you have afternoon rounds, I'm sure, and then you're on call, and then you have
Mhm.
to deal with the brunt of these microaggressions. So just give us a sense of what your mindset is when this happens to you.
Yeah. I would say early on, as a student, I really just took it because I was honestly pretty anxious and just really tried my best to just stay out of the way. But as an intern, I did have those higher expectations that I mentioned, and it made me angry
Hmm.
early on. I got mad. I got mad, and I would do my best to respectfully, call people out when they did these things. But what I found is that I only ended up getting myself in trouble. I
How
mean,
so? What did you get called into
uh,
the program director's office? Like, what do you mean by that?
getting reported,
Oh.
getting reported. Yeah, a lot of these people are very, very happy to report residents.
Hmm. And what are the consequences if that happens to you?
I think so far, I feel like my program has had my back.
Hmm.
They've listened to my side of things and, haven't just jumped to conclusions. But I think it puts you on a radar,
Hmm.
even if your program's got your back. I mean, when these things pile up, you start to feel a little more uncomfortable with your, position at your job as you get more and more of these reports. So I don't know. Eventually, a lot of us just stop caring. We just take it,
Hmm.
keep our heads down, power through.
And does that have a detrimental effect on patient care?
I would say at least on our end of things, it hasn't that I've witnessed. It's detrimental to resident mental health, contributes to burnout. Everybody wants to talk about burnout. It seems people want to solve it with wellness talks and modules, but that's not how you solve burnout. A lot of us are burned out because, well, for one, we're underpaid, we're tired,
Hmm.
and then to have to go to work and you just want to do your job. I just want to go to work and I just want to do my job. And it just having to deal with this just every day kind of grating on your self-esteem and disrespect, it makes things hard.
So when you talk about this with your attending physicians, your mentors, program directors, and this issue comes up, what is their normal response to address something like this?
Yeah, that's a good question. Depending on who it is, as I said, I'm lucky at my program that they've listened to me. And a lot of times, after explaining my side of the story, they kind of brush it off like, oh, it's fine. But it still bothers me that it even happened.
Hmm.
Even though my program does have my back and listens to my side of things, the fact that I'm even having to go meet with them, I think, it's still going to bother me. So, for the most part, they've been very supportive. Actually, one of my attendings really had my back the other day, where in the ED we kind of butted heads, and the ED physician didn't agree with my management of things, and
Hmm.
I was just trying to do my job.
Yeah.
But because I was a resident, he didn't trust what I had to say, so kind of had an issue there. But my attending came in and he listened to what I had to say and talked to that physician, and I felt like, it was nice to know that somebody had my back for once. I think that's really how we can try to at least somewhat solve this issue is I'm not a medical student anymore, but I look out for the medical students. When they're on rotations with me, I tell them to come to me if anybody treats them badly, and I will help them deal with it.
Hmm.
And I truly believe that makes them feel better just to know that somebody has their back. In the same way, I think as a resident, knowing that there's an attending out there who would do the same for me because they have more power than I do, just like I have a little bit more power than a medical student. I think just knowing that they're there for us and, have our back if it comes down to it.
Is this something that's seen primarily in surgery residencies? Are you seeing the same disrespect happening outside of surgery, internal medicine, or some of the other non-surgery specialties?
No, I would say, this is pretty universal regardless of specialty, regardless of hospital you're at or program. It's just, a cultural thing because I feel like healthcare in itself has the tendency to be toxic.
Hmm.
And then when you put powerless residents in the mix of that who can't defend themselves, it's just a recipe for things to get even worse.
So let's talk about some paths forward. I know that there are some residency programs that are unionizing to advocate for better work environments. Do you think that's a solution? If you're in charge, what would you do?
I think it's a good first step. I think, it's one of the few things that we can do because there isn't a lot. We don't have much control over our pay. We don't have control over the hours we work. I think that's a great first step, along with just we should have each other's backs. I think a big thing would be for attendings after they graduate residency, don't forget what it was like.
Hmm.
Because I feel like once people get through it, that a lot of people just stop caring. It's not their problem anymore. But I want this to stop. I don't want to see more residents behind me go through the same things that I've had to go through. I don't want medical students going through the same things that I had to go through. And I think we should always be striving to, make this a healthier work environment for everyone. And a lot of attendings, they'll say, oh, things were way worse when I was a resident, but I think that's besides the point.
Hmm.
I think just because things were worse back then doesn't mean we shouldn't be trying to make things better for the future right now.
And where do you turn to for support? Do you turn to your fellow residents? What are some resources for you whenever your mental health is stressed like this because of what's going on.
Yeah, definitely my co-residents. It's always good to have somebody to vent to. I feel like that's half of our conversation. Co-residents, I've got some really great attendings that I feel comfortable with. And my husband, he's very supportive, and I always tell him like, my job's hard, but I feel like you're going through this whole thing with me
Mhm.
because it's hard on the spouse too. And it's like it kind of feels like me and my husband at times we're just kind of getting through this, stage in life together.
Now, for those medical trainees who may be listening to you on this podcast or read your article on Kevin MD, and of course, they may be going through similar microaggressions or similar scenarios to what you're describing, what kind of advice can you share with them?
Yeah. I think it's hard. It is hard to get rid of that fear of getting in trouble, of getting reported, but absolutely there is a respectful and professional way to stand up for yourself. And I think the more of us who do that, the better things will get. Med students, and if you don't feel comfortable, talk to a resident that's on your team that you feel, safe talking to, because usually you can find at least one on a team. So we just we've got to stand up for each other, and we've got to stand up for ourselves. And I just think we all need to understand that there is absolutely a professional and respectful way to do that. And if you still get reported, you know that you did the right thing. You know that you stood up for yourself, and you have nothing to be ashamed about.
We're talking to Audra King. She's a surgery resident. Today's Kevin MD article is Diary of a Resident, Dr. Punching Bag, MD. Audra, let's end with some take home messages that you want to leave with the Kevin MD audience.
Yeah, absolutely. Again, I want to stress that, besides the long work hours and the low pay, just I want people to be aware of what residents are going through on a daily basis. That they're often, their self-esteem from the time they're a third year in medical school to graduating residency, it takes quite a beating. And I think it's important for, both healthcare workers and, just people out in the world to be aware of that. And, the first steps towards changing something is awareness. And we've got to have each other's backs.
Audra, thank you so much for sharing your story, perspective, and insight. And thanks again for coming on the show.
Absolutely. Thank you for having me.